All right, Cole and Josh here. We are going to discuss a new test that I learned in the clinic this year and go over that with you. We did go over Josh's videos for musculoskeletal assessment. He did a phenomenal job with the majority of things. A few different tips were given on body positioning. Other than that, he did a phenomenal job. But we're going to talk about the Tyler test, which was brought up in orthopedics in our class the second year, and it's something that I use in the pro bono clinic this year. A test used that can be an objective measure for assessing posterior capsule tightness on a shoulder. In the pro bono clinic, we saw that an individual that I had a case of GERD, glenohumeral internal rotation deficit, and basically what we do with this test is we have the humerus rest on the posterior capsule, and then we take a measurement, we apply our treatment, and then we take the measurement after the treatment to see if it was an effective treatment. So Josh here is going to demonstrate how to perform the Tyler test, and then afterwards I'll talk a little bit about the parameters.
All right, so for the Tyler test, we're going to have our patient sideline position. They're going to be facing towards us, okay? So for this test, we're going to take our patient's affected arm, kind of flexed up to a 90-90 position, and what we're going to do is we're going to use one arm and apply pressure in towards their latissimus dorsi and in towards their scapula, so applying a lot of pressure and putting them into that posterior capsule position. And what we're going to do when we apply that pressure is we're going to let their arm drop while continuing to apply that pressure so their scapula stays firm behind their shoulder. And what we're going to do is watch their shoulder drop and then measure from their medial epicondyle down to the table to see where that objective measure is at. And that's how we're going to measure for GERD and their internal rotation ability and see where that posterior tightness is at.
So Josh did a good job explaining that test. As he said, it's kind of objective when you apply that pressure. So the research says that the inter-tester reliability is high when the same clinician performs the test on the same patient in the same session. So we don't want other people obviously applying a different pressure. And then as far as taking the measurement goes, it's helpful to have another individual in the room, PTA, or whatever that may be, to take the measurement from the medial epicondyle to the table. If you're an experienced clinician, you can probably do that with a straight edge ruler. But yeah, that's what we would use as an objective measure. Apply our treatment, mobilizations, whatever it may be, to help loosen up that posterior capsule, and then take an objective measure to see if there was improvement. You should see a decrease in the distance between the medial epicondyle and the table because we're loosening up that posterior capsule.